Let us now go to general adult tests. The topic is measuring your heart's rhythm. Your heart has a natural electrical circuit that is continually active. This electrical activity starts in the upper right chamber and travels along a conducting pathway to the lower chambers, causing the heart to pump and creating your heartbeat. Although it is not possible to visualize the electrical circuit directly, the electrical pattern can be visualized on an electrocardiogram, also known as ECG or EKG. An ECG can be used to diagnose a possible cause for symptoms such as chest pain, dizziness, breathlessness, or palpitations. It can also be taken to check the heart's health prior to an operation or if you have a family history of heart problems at a young age. For the test, you will lie down on an examination table. The technician will apply 6 small sticky pads called electrodes to the front of your chest and 1 to each arm and leg. Wires from the ECG machine will then be clipped to each pad. You will be asked to keep still while the recording is made, which only takes about 30 seconds and is completely painless. The ECG shows how fast your heart is beating and whether your heartbeat is regular. It may indicate that your heart is healthy and beating normally. However, it may reveal features of a heart attack and can also indicate if you have had a heart attack in the past. Other changes on the ECG may indicate abnormalities in the normal electrical conduction pathway or in the heart muscle, as well as an abnormally fast or slow heart rate. Sometimes you may be sent for further tests, such as an ambulatory ECG or an exercise ECG. It is possible for you to do a mini ECG recording yourself using some of the latest smartwatches or specific handheld devices. These are linked to an app on your cell phone and they produce an ECG tracing from a section of your ECG. The tracings are particularly useful if you have palpitations or there are concerns that you have an irregular heartbeat, because an ECG record can then be done at the exact time the symptoms occur and may help diagnose conditions such as atrial fibrillation. Some self-help measures on keeping a healthy heart is maintaining a healthy body weight, keeping your blood pressure normal, eating a healthy balanced diet, quit smoking and limit your alcohol intake, and exercising regularly. The ECG is a series of tracings printed onto graph paper that give a graphical representation of the electrical activity of your heart at that particular time. This image shows a tracing from one section of an ECG of a person with a normal heartbeat. A resting ECG is taken while you lie comfortably on your back with the electrodes that take the measurements attached to your skin. An exercise ECG is usually done on a treadmill. Before and during the test, your heart rate and blood pressure will also be measured. Thank you so much for your attention.
Let's now go to pathology. Let's discuss external pathogenic factors. The relative strength of pathogenic factors and upright Qi is probably the most important factor in treatment with Chinese medicine. In treatment, it is absolutely essential to determine whether a condition is full, empty, or full or empty. The importance of diagnosing correctly the full or empty or full or empty character of a condition cannot be overestimated. Such diagnosis influences the principle of treatment and the therapeutic results. It would be completely wrong to tonify the upright Qi in a full condition or expel pathogenic factors in an empty condition. In full or empty conditions, diagnosing the relative importance and balance of pathogenic factors and upright Qi is still very important. In full empty conditions, it is not simply a matter of simultaneously expelling pathogenic factors and tonifying the upright Qi. In such conditions, the treatment principle must be based on a careful assessment of the relative strength of pathogenic factors and upright Qi and the pathology of each individual case. Although balance between expelling pathogenic factors and tonifying the upright Qi, the treatment will nevertheless always place the emphasis on one or the other. Pathogenic factor has a broad meaning in Chinese medicine. This may be an external pathogenic factor, such as external wind or external dampness, or internal pathogenic factor such as phlegm or blood stasis. External pathogenic factors. External climate factors derive from the environment, and when they invade the body's interior, they become external pathogenic factors. External pathogenic factors can become internally, usually changing their nature in the process. For example, external wind may turn into heat and become internal. As we can see in the diagram, from the environment, the external pathogenic factors invade the body's exterior and may penetrate in the body's interior, and then becomes internal pathogenic factors. Diagnosing the full or empty character of the condition is the most important factor in deciding the treatment principle. Examples of external pathogenic factors are wind, dampness, summer heat, and cold. As etiological factors are important for any practitioner to know about in order to counsel patients about their lifestyle. For example, about the importance of avoiding exposure to artificial types of wind, such as strong fans or air conditioning, or advising young women about not going out in cold weather with their abdomen exposed. Pathogenic factors represent the pathology rather than etiology. In a woman has if a woman has a very painful periods with small dark clots, a pronounced clot feeling during the period, and the period pain is relieved by the application of heat, then the pathology is that of cold in the uterus. The diagnosis is done on the basis of clinical manifestations, and we do not need to ask whether she was exposed to cold. External pathogenic factors. The external pathogenic factors derive from the environment. External pathogenic factors can become internal, and the external pathogenic factors include wind, dampness, summer heat, and cold. Thank you for your attention. Let's now go to Foot Yang Ming Stomach Meridian. Let's discuss Stomach 9, Ren Ying, People Welcome. Foot Yang Ming Stomach Meridian. The Foot Yang Ming Stomach Meridian is located at the anterior margin of the sternocleidomastoid muscle at the level of the upper border of the thyroid cartilage. Stomach 9, Ren Ying, People Welcome, Persons Welcome, Man's Prognosis, Fivefold Confluence, Celestial Fivefold Confluence, Window of the Sky, Point of the Sea of Chi. As a window of the sky, this point strongly affects the spirit and mind, enabling the person to receive, to welcome others, life, and love. In a state of balance, a movement of earth within us goes from our center to the periphery. When deeply in balance, we forget to receive or to reach across to others. We shut down to our core, untrusting and feeling divorced from humanity. Suspicious of the motives of others and lacking empathy for all is a lonely and arid experience. People Welcome refreshes the senses and allows in new experiences and ideas rather than staying with the self-absorption earth can fall into. When the patient is ready to open to change and possibilities, this can be a wonderful point. The reconnection with heavenly influxes allows us to align our intent with sincerity. Located near the larynx, which provides resonance for the voice, this point enables one to feel reconnected with the world, able to express needs and support the others' needs of others, swallow new ideas, and re-enter into life. From stomach 9, the stomach meridian travels down, linking the head, the heavenly part of our being, with the upper torso, the person, humanity part of the body. In the Chinese division of the body into heaven, humanity, and earth, this heavenly point encourages us to embody our intent, our ideas, and manifest them through the body. As a seat of Qi point, Ling Shu 33, along with REN17, bladder 10, or sometimes DO15 and DO14, people welcome can be used to regulate qi. The text says that if the C is replete, there may be fullness in the chest or abdomen, congestion, or a florid complexion. If deficient, there will be weakness and loss of voice. This combination is only called upon in chronic situations when the deep regulation and reserve at the C can offer is necessary. Stomach 9 used to regulate qi, especially where there are imbalances with excess above and deficiency below. Stomach 9 removes obstructions from the head and sends qi downwards. It is used for regulating blood pressure, subduing rebellious qi of the stomach or lung, where there is hiccough, belching, or asthma. Locally, it benefits and regulates the throat. It removes masses, resolves swellings, and affects the throat, so it can be used to clear heat and swelling, affecting the stomach meridian, tonsillitis, swollen and sore throat, goiter, and painful obstruction in the throat, the pharyngitis. In indications, reconnects and re-enters as into the world and consciousness, helpful in recovery from burnout, regulate blood pressure, subdues rebellious qi, the local point for pain and swelling in the throat. For the location, it is 1.5 con lateral to the anterior midline on the level of the laryngeal prominence and at the anterior border of the stomachocleidomastoid muscle. To find from the laryngeal prominence, palpate posteriorly to the anterior border of the sternocleidomastoid muscle. The stomach 9 is located at the anterior border of the muscle, which becomes more clearly visible and palpable if the patient's head is turned in the opposite direction. Located on the same level are small intestine 16 on the posterior border of the sternocleidomastoid muscle and large intestine 18 between the two heads of the sternocleidomastoid muscle. For needling, if necessary, move the head to its normal position before needling. Caution: the carotid artery, carotid sinus, jugular veins. The carotid artery is located directly at the anterior border of the sternocleidomastoid muscle. The needle should be inserted anterior to where you can feel the pulsating of the carotid artery, vertically 0.5 to 1 con between the artery and the thyroid cartilage. For reasons of safety, the artery should be held in a lateral position with one finger of the palpating hand above and one finger below the insertion site. Irritation of the carotid sinus can lead to a lowering of the blood pressure and fainting. For actions or indications, regulates the qi, opens the channel, and harmonizes excess or deficiency in the thorax. For special features, window of heaven point, sea of qi point, and meeting point with the gallbladder channel. Window of the sky, point of qi, crossing point of stomach and gallbladder. This is the only window of the sky point on either of the two earth officials. Stomach 9 is a powerful point and is indicated if patients, particularly earth CFs, have difficulty in accepting the concern, intimacy, sympathy, or even love shown to them by other people. As a point of the sea of qi, it can strongly energize this meridian, and it is said to help regulate blood pressure, the local point for throat disorders. Thank you for your attention.
Let's discuss liver patterns, liver yin deficiency. Concept, this is due to yin deficiency failing to moisten and nourish the liver. The pattern of deficiency of liver yin results from consumption of yin fluids in the liver. Further development of liver yin deficiency will fail to restrain yang. leading to a deficient heat pattern affiliated with liver-young hyperactivity. Clinical manifestations, there is dizziness, tinnitus, dryness of the eyes, blurred vision, tidal fever, red cheeks, dry mouth and throat, feverish sensation in the chest, palms and soles, night sweating, creeping of the limbs, small involuntary movement of the limbs, a dull burning pain in the costal and hypochondriac regions, red tongue with liquid fluid, and a taut, ready, and rapid pulse. Key symptoms, malnutrition of the head, eyes, sinews, and vessels. The liver channel complicated by yin deficiency generating a deficient heat pattern. Here, the table of analysis of liver yin deficiency pattern. First, fails to moisten and nourish the head and eyes. There is dizziness, tinnitus, dry eyes, blurred vision. Fails to nourish the liver channel and deficient fire enduring this burning pain in the costal regions. Fail to nourish sinews and vessels. There is creeping sensation of the limbs. There is loss of nutrients and moisture from the head, eyes, sinews, and the liver channel. Next, yin fails to restrain yang, deficient heat harassing internally. There is feverish sensation in the chest and palms. Deficient heat endures yin qi. There's night sweating. Deficient heat rises upward. Red cheeks. Failure to raise yin fluids upward. There's dry mouth and throat. Red tongue with scanty fluids and not ready, wiry, and rapid pulse are symptoms of liver yin deficiency and deficient fire harassing, which is the yin deficiency. For the summary of liver yin deficiency, the etiology, a diet lacking in nourishment, excessive use of drugs, chronic illness, too much sexual intercourse, overexertion. Underlying accompanying pathology, kidney yin deficiency, liver blood deficiency, may allow yang to become hyperactive and even win to steer internally. Signs and symptoms, there is dizziness, headache, blurred vision, visual floaters, dry eyes, poor night vision, scant menstruation or amenorrhea, numbness and tingling of limbs, insomnia, dull pale complexion, with redness around cheekbones, muscular weakness, cramps, brittle nails, very dry skin and hair, depression. For the pulse, floating and empty, tongue is normal color and filled. Treatment principle is to enrich yin, nourish blood. For the acupuncture treatment, we use bladder 17 with moxa, it supplements blood. Bladder 23 supplements kidney to produce yin. Spleen 6 regulates liver, nourishes yin. Stomach 36 nourishes yin and blood. Kidney 6 nourishes yin, clears empty heat. Bladder 20 supplements spleen to produce blood. Liver 8 nourishes liver yin and blood. Kidney 3 supplements kidney yin. Ren 4 nourishes kidney yin. Extra point Yu Yao benefits the eyes. Relevant advice, it is essential that the person who is liver yin deficient gets enough rest and relaxation. This means that they must have an ample sleep and go to bed early at night. They must not work too hard nor spend too much time watching television and staring at the computer screens. They should avoid stimulants such as coffee, which would stress their system. Alcohol is not good for them because it is both spreading and warming in its energy and creates heat in the liver, which can induce liver yin. Dynamic activities such as aerobic or action sports will be detrimental and should be discouraged because they will further consume yin. The person should instead cultivate gentler and more meditative forms of motions such as qigong, yoga, and tai chi. Massage and meditation are especially beneficial because they increase peace and tranquility in the body and thereby benefit yin. The client should try to avoid foods that are stimulating and warming. This includes coffee, alcohol, dark chocolate, and hot spices like chili. Generally, concentrated proteins, cereals, and root vegetables nourishes yin. Green leafy vegetables will be especially good because the green color will resonate with the liver and thereby directly tonify liver yin. Using a lot of water in the preparation of food, especially soups and stews, is preferable to baking things in the oven, which is more drying. Oil and products that have a high oil content, such as nuts and seeds, will nourish and moisten yin. Foods that specifically nourish liver yin are artichokes, beetroot, tomato, avocado, seaweed, dates, grapes, lemon, nettles, olive oil, lima beans, mung beans, kidney beans, pine nuts, sesame seeds, tahini, crab, oysters, beef, liver, and rabbit. Thank you for your attention. Let's discuss inquiring chills and fever. The production of chills and fever is related principally to the abundance or depletion of the organs yin-yang. Illnesses resulting from the exposure to cold, evil generally manifest coldness symptoms, whereas those resulting from exposure to heat, evil generally manifest hotness symptoms. Yin abundance or yang deficiency mostly shows coldness symptoms, whereas yang abundance of yin deficiency mostly show hotness symptoms. Hence, asking about chills and fevers helps to understand the nature of pathogenic evil and to ascertain the ampleness of the body's yin and yang. Clinically, chills and fever can manifest the following patterns. First, the cold aversion and cold intolerance. Cold aversion means that the patient dislikes cold and feels better when warm. This occurs mainly in various conditions of internal injury. Because yang qi is deficient, it is unable to warm the exterior. Cold intolerance means the patient dislikes cold and does not feel better even when warm. This occurs mainly in exogenous illnesses of the exterior. Because evil qi has attacked the exterior and defensive yang is obstructed, the exterior loses its warmth. Simultaneous fever and cold intolerance occurs mainly in exogenous illnesses, especially in the early stages. If there is more intolerance of cold than fever and the pulse is floating and tight, it is a cold illness in the exterior. If there is more fever than intolerance of cold and the pulse is floating and rapid, it is a heat illness of the exterior. If the cold intolerance and fever are accompanied by sweating and a floating and even pulse, it is a deficiency illness of the exterior. If the cold intolerance and fever are accompanied by aches in the body and head, but not sweating, and the pulse is floating and tight, it is a strength illness of the exterior. Next is fever and feverishness. Fever means a body temperature higher than normal. Feverishness means feeling hot despite a normal body temperature. Fever and cold intolerance occurring in same illness are mostly due to exogenous pathogenic evil in the exterior. Fever without cold intolerance is mostly due to interior heat. The most common pattern are the following. High fever. The body temperature is greater than 39 degrees Celsius, is persistent, and is not accompanied by cold aversion. This occurs in illness of heat strength and results mostly from exogenous heat or exogenous cold entering the interior and transforming into heat. In the latter case, strong heat in the interior has diffused to the exterior. Next, recurrent fever. In this condition, the fever or feverishness occurs regularly like the tide. Hence, this is also known as tidal fever. There are three such patterns clinically. Recurrent young fever, the fever is typically quite high, especially between 3 and 5 o'clock in the afternoon. Also typically abdominal distension and constipation accompanied by fever. It is the result of heat evil mixing with the chyme and retained food in the stomach and intestines. Recurrent fever of dampness heat. In this pattern, the skin does not feel hot when first touched but becomes hotter with prolonged palpation. The fever tends to be mild in the morning or night but rises in the afternoon. It is accompanied by chest tightness, heaviness in the head and body, and a greasy tongue coating. It is the result of dampness and heat accumulating in the interior and the trapped young qi not being able to reach the exterior. Recurrent fever of yin deficiency. This is typically a low-grade fever in the afternoon and at night. Along with fever, there is a flushing of the cheeks, night sweats, and hotness in the 5 centers. This is due to internal heat arising out of the yin deficiency. During the afternoon and at night, defensive yang returns to the interior, causing the interior temperature to rise. Next is low-grade fever. Here, the temperature is typically between 37 degrees Celsius and 38 degrees Celsius. It is often seen in illness due to deficiency of yin, blood, or qi, as well as in the late stages of heat diseases. Dysphoria with feverish sensation in the chest, palms, and soles. This is a feverishness in the chest, 2 palms, and 2 soles with dysphoria. The body temperature may or may not be raised. It is mainly seen in illness of interior heat due to yin deficiency, but also when exogenous heat evil has entered the yin level of the warm diseases, nutritive or blood level. Next is alternating chills and fever. Alternating chills and fever reflect the struggle between evil qi and genuine qi and is due to evil qi accumulating in the area between the exterior and the interior. Clinically, it has 2 main patterns. In one, the alternation is regular. This is typical of malaria. In the other, the alternation is unpredictable. This is seen mainly in the illness of Xiaoyang meridian. Thank you for your attention.
Let us now go to interview and history taking strategies. The topic is taking a health history. The health history lays the foundation for care. It guides the relative emphasis placed on each system in the physical examination and the formulation of differential diagnoses and treatment decisions. A weak foundation places the patient at risk for misdiagnosis and inadequate or erroneous treatment. It also identifies the clinician as one who does not practice within acceptable standards of care, making the clinician vulnerable to legal action. Having the patient participate in developing their health history is a powerful tool for building a partnership between patient and provider. A well-designed, culturally and linguistically appropriate health history form helps to move the patient from passive responder to active collaborator in developing the personal database that will drive future decisions about their care. It also begins the patient education process. The form requires the patient to complete a review of past and current health and to reflect on the potential impact of healthcare behaviors, beliefs, and values upon their health status. Engaging a patient in this reflective process helps to give a sense of ownership over their healthcare data and primes receptivity to future patient education. The ultimate goal of all healthcare is to maximize the health and well-being of the patient. Whether this involves health maintenance and disease prevention or the actual treatment of a medical or surgical condition, many patients will be asked to make major sustained changes to their current behaviors in order to acquire or sustain their desired level of health. Adherence to a therapeutic regimen is influenced by multiple factors, including the patient's perception of the severity of the need or condition and the cost benefits associated with adherence. By actively involving the patient in the development and analysis of a personal health history, the clinician lays the groundwork for active participation in identifying healthcare goals and in designing a culturally congruent plan of care. An ongoing collaborative process supports patient autonomy, enhances adherence, and increases the likelihood of achieving desired clinical outcomes. Here are some tips when conducting the interview and health history. First, demonstrate professional appearance and behavior. Unkempt, overly casual, or inappropriate dress or unprofessional behavior do not inspire confidence. Second is provide for privacy. Health histories contain highly confidential information and should be obtained in settings that maximize the patient's privacy. Third is provide a quiet and non-distracting environment wherever and whenever possible. Unless it is essential to your professional role, it is best to turn off your cell phone and not interrupt the flow of the patient's history. Fourth is address the patient by the appropriate title, be it Mr., Miss, or Mrs. Next is always introduce yourself to a new patient and identify your role. For example, I'm Ms. Rogers, a nurse practitioner. Next, request the patient's permission to conduct the health history. Try to obtain historical data with the patient fully clothed. Clothing is important to a sense of personal integrity and identity. Next is position yourself at the same level as the patient to avoid establishing the provider as being dominant in the relationship. Next is recognize potential biases that may adversely affect your ability to elicit an accurate and complete health history. Observe the patient for any sensory deficits such as hearing or visual loss and adjust your interviewing techniques and positioning accordingly. Next, prioritize information needs to maximize conservation of the patient's physical and emotional resources. Patients in pain or acute stress require special consideration. Next, know and respect the cultural norms and values of individual patients and adjust interviewing techniques. Do not impose cultural norms on the interviewee. If language barriers necessitate using a translator, address the questions to the patient, not the translator, and allow adequate time for the translation and response. Next, ask the patient if it is acceptable if you take brief notes during the interview. Assure the patient that all of the information that is provided will be kept confidential and used as a basis for care decisions. If the information provided by the patient will be used for other purposes, such as to obtain third-party reimbursement, the patient or guardian must be asked to sign a release authorizing approval for these additional uses or privileged healthcare data. Next, use open-ended questions whenever possible to elicit information during the history-taking interview. Do not suggest symptoms or descriptors to the patient or informant, especially in the initial portion of obtaining the history of present illness. Next is help patients to become partners in the caregiving process. Ask about their healthcare goals and expectations about their care. Give the patient adequate time to respond. Do not create a hurried atmosphere, especially when eliciting sensitive information. Next, do not use technical terms or medical jargon. Every health history presents an opportunity for patient education. Give your explanations in language that the patient can comprehend and use. Be an attentive, non-judgmental listener and an alert observer throughout the health history. Do not interrupt prematurely and control an urge to fill every pause or silence with another question. Next, observe nonverbal behaviors throughout the interview, such as significant affective and postural changes. These often occur in areas of the health history that contain sensitive information that requires more in-depth exploration. Next, acknowledge the value of the patient's information through the use of supportive statements during and at the end of the clinical interview. A statement such as, "Mr. Jones, you have provided a very clear picture of your symptoms. This will help us to make much wiser choices about what tests to order." Next is validate your perceptions when the patient has completed telling you a piece of information or expressed a particular healthcare preference. Also, if the interview yields contradictory information, revisit earlier areas of inquiry to check for consistency or response of the patient to clarify your perceptions. And lastly, beware of prematurely cutting off a line of diagnostic inquiry. Although a patient's presenting symptoms may strongly suggest a particular diagnosis, failure to adequately explore alternative explanations may cause the clinician to falsely reject an important differential diagnosis. Thank you so much for your attention.
Let's now go to 5-element constitutional acupuncture. Let's discuss element points. The element points, Ling Shu Chapter 1 compares the channels to rivers, starting with a well at the tips of the toes or fingers and flowing into a spring, stream, and river until it reaches a sea at the knee or elbow. Here, the qi travels deeper inside the body. This transformation is associated with particular points on the channel, which are usually called the 5 shu points. In the Nanjing, these points are linked with each of the elements. These points are frequently used by 5-element constitutional acupuncturists. The use of element points. First, they are most often used in the form of tonification or sedation points that are used to transfer qi around the Sheng cycle. They can be used to transfer qi between organs across the Ke cycle. Third, they can be used to treat a patient's element within the element. Once the patient's CF has been diagnosed, practitioners may attempt to refine their diagnosis so that they can more accurately discern the nature of the imbalance. One way of doing this is by diagnosing the element within the element. The Ling Shu Chapter 64 also sets out the idea that each element is represented within each element. Shibo says, first establish the 5 appearances of metal, wood, water, fire, and earth. Separate them into the 5 colors. Differentiate them into the 5 body types of man and then the 25 types of men as a whole. This is reflected in the attribution of a point on each channel that corresponds to each element. The earth point on the heart channel, Shanmen or heart 7. The water point is Shaohai or heart 3. An earth CF, for example, may be deficient in water within the earth. This could lead to the body fluids drying up and a more agitated and insecure personality. In this case, they might exhibit an excess of body fluids and perhaps a stodgy mind and character. This diagnosis can only be made by perceiving, for example, that the yellow on the face is a bluish kind of yellow, that the singing tone of voice is a groaning kind of singing, that the odor is a putrid kind of fragrant and fearful craving for sympathy. This is obviously a very hard diagnosis to make. It is extremely difficult to differentiate between someone whose CF is earth and whose water within the earth is also imbalanced compared with someone whose CF is earth, but the water element itself is imbalanced, as you can see in the chart below. Thank you for your attention. Let's go to erectile dysfunction. Let's discuss factors affecting erection. Factors affecting erection. Governing vessel, kidney yang, minister fire, the fire of Ming Men, blood and heart blood, penetrating vessel in 7 ways, sea of blood, postnatal qi, prenatal qi. The penetrating vessel controls the membranes. The penetrating vessel controls the ancestral muscle. The penetrating vessel controls the connecting channels in the penis. Communication between heart and kidney. The liver channel, main connecting muscle and divergent wraps around the penis. As you can see in the diagram, the heart blood, the liver blood, the penetrating vessel, kidney yang, Ming Men, these are all factors affecting erection. Governing vessel, kidney yang, minister fire, fire of gate of life or Ming Men. Erection needs movement and action phenomenal with the characteristics of yang. Erection therefore needs yang qi deriving from kidney yang, the fire of the gate of life. A deficiency of kidney yang and of the minister fire is a common cause of ED in both young and old men. Heart and heart blood. The penis needs the action of the heart for erection in two ways. Firstly, heart chi needs to descend to the penis to promote erection, which needs chi, in the same way as heart chi descends to the uterus to promote menstruation. Secondly, the heart governs blood and the penis needs to fill with blood to achieve an erection. The penetrating vessel. Erection relies on the penetrating vessel in 7 ways. The penetrating vessel is the sea of blood and provides blood to the penis for the erection to occur. In this sense, this function of the penetrating vessel occurs in synergy with that of the heart. The penetrating vessel is the sea of channels, and it is closely connected to the postnatal chi of the stomach through the point stomach 30 chi chong. Therefore, the penetrating vessel also provides the chi necessary for erection to occur. The penetrating vessel is also connected to the prenatal chi of the kidneys, and this is another way in which chi helps erection. In other words, for erection to occur, it needs both the postnatal chi and the stomach and the prenatal chi of the kidneys. The penetrating vessel controls the membranes, and as we have seen, most of the tissues in the penis are part of the membranes. The penetrating vessel influences the ancestral muscle discussed above, which, as we have seen, is the penis. The penetrating vessel controls the connecting channels in the penis, which allow it to be filled with blood when erect. And the penetrating vessel plays an important role in allowing the communication between the heart and kidneys, and therefore the descending of heart blood to the penis. Lastly, the liver channel. The liver channel has an important influence on the penis as all its channels, main, connecting, muscle, and divergent, wrap around the penis. Therefore, the liver channel plays a role in the pathology of erection, for example, when it suffers from chi, stagnation, or dampness. Thank you for your attention.